This is called a scoliosis or towering spine, and we treat this with great regularity here in our clinic with good results. So if you ever come across somebody who has one of these, please let them know, because there's some conservative things that can be done chiropractically that greatly affects beneficially this condition. Notice when you look at your spine from the side, and in this case the person's facing this way, you want to see some curves. These are what's called the primary curves of your spine, and they're the shock absorbers for your body. I weigh about 165 pounds. Every step I take, several hundred pounds of pressure, in fact about 550 pounds of pressure are being exerted down my spine, through my pelvis, down my legs, and into the ground. So these are the shock absorbing mechanisms. When I see a neck that no longer looks like this, but instead looks like that, or even worse, like this, which I see very frequently from automobile accidents, that gets my attention. Because now, once again, we've lost the shock absorbing mechanism for your neck. Your head, believe it or not, supports about 12 pounds of weight from your head. And so it's very important that we have that curve. When I see a low back that's no longer curved but straight, for example, from a fall, years of poor sleeping positions, an accident, lifting accidents, things like this, that gets my attention because once again, we've lost the shock absorbing mechanism for that person's spine. Notice there's these little yellow structures that are between the bones. These are called discs, and they do three important things that you should know about. First of all, they literally are holding you together. They're growing into the end plates of the vertebral bodies, top and bottom, and they keep you together. In fact, if Felicia and I were playing tug of war with a real person, we'd probably break a vertebral structure before we actually broke the disc, because they're very strong when you're pulling them apart or compressing them. There's a relatively easy way to damage a disc, and we'll discuss how that happens in just a few moments. But for compressing and distracting the disc, they're very, very strong. The second thing that the discs do, besides hold you together, is that they separate the structures in your spine so there's room for these little yellow nerves to come through. And so the more space that we have for the disc, the larger the hole for the nerve is, and the less chance that they're going to be irritated. The third thing that a disc does is it allows you to do a movement that you may not have even thought about, but it's called torsion. And torsion is this torquing movement that you need to be able to do in order to do three important things. Number one, walk. You've probably never thought about this, but every step you take, not only is your spine going up and down like this, but it's twisting as you take a step to enable you to walk across the surface of the planet. You probably never noticed it because you're wearing clothes, you have muscles and other tissues, and you don't see your spine moving in that way. But every step you take, you're performing torsion. In order to bend down, you don't just bend down, you actually twist as you bend in torsion to pick something up. In order to reach for something, you have to be able to perform torsion. In order to throw something, you have to be able to perform torsion. So torsion is essential for most body movements, and you can't perform them without healthy discs. And that's why when a disc is injured, it gets your attention very quickly because you're using it in almost every type of movement. The other thing that I didn't mention, and I want to make sure, is talking about these discs, because I'd mentioned to you that they are very, very strong when you are compressing them or when you are distracting them. But there's a weakness in the disc material, and it has to do with a movement, or two basic movements, a lifting and twisting movement or a falling and twisting movement. And when that occurs, it's very easy, relatively, to damage a disc. And when you do, you have something that looks like this on the model or like this on the chart. There's various names for it, but they all mean the same thing, and you've heard a variety of them, and maybe got confused because there's so many different names. Slip disc, herniated disc, ruptured disc, protruding disc, disc bulge. They all mean the same thing. The disc material has torn, it's bulging out and pinching on that nerve. We treat about 30 people a day following this type of injury, and we get really, really good results. Our job is to keep the patient from having to have surgery, because that's a very invasive thing. I'm not against the surgery if it's necessary, but if we can avoid it, it's so much the better. We also have installed in our clinic this piece of equipment right here, which is called a spinal decompression table. It's the table that you see the blue straps on. And that table is the result of many years of research by NASA. And they're the government agency that basically came up with the treatment protocol for decompressing discs without going in and cutting them off with a scalpel and doing an invasive operation. So we have a lot of weapons here in our clinic for treating people who have disc protrusions. So once again, if you know somebody that has one and they're contemplating surgery, please let them know about the chiropractic here in the clinic and also the weapons that we have to combat the situation. Notice there's these little yellow things that are coming through. These are called the spinal nerves. Of course, your brain is inside your skull. There's a hole at the bottom of the skull called the foramen magnum. The spinal cord itself runs through the hollow part of the spinal column, and between each bone there's a pair of nerves that come out, and including the holes or the foramen for the sacrum, which is this triangular shaped bone, and the tailbone down here, there are 31 pairs of nerves. They go to some really important places that we're going to talk about in just a matter of moments. Now, there's not too many animals on the planet that can do all these miraculous movements that you and I are designed by God to be able to do. And the reason we can do all these neat movements normally, under our ideal circumstances, is because of the very complex joint structures that make up your spine. There's different types of joints, and the ones I'm talking about this evening are called the gliding joints. And a joint, to be very basic, is where two bones fit together and allow a body part to move. These two bones are very smooth where the joint is, and in nature, the two flat surfaces are covered by a connective tissue called cartilage. And cartilage is a bluish substance that is very, very slippery. It's sort of like having two pieces of ice and you're rubbing them together. There's not a whole lot of friction under ideal conditions when you have the joints functioning as they should and you've got two layers of cartilage gliding over one another. Surrounding the joint is something called a capsule. You don't see the capsule on this model, but it's a piece of connective tissue that surrounds the joint, protects it, and also secretes a lubricating fluid called synovial fluid. And synovial fluid is like the motor oil in your truck or car. As you know, the motor oil lubricates all the moving parts so your engine doesn't overheat and burn up and explode. And it's sort of like having two pieces of ice and now you're pouring motor oil on top of the ice, and we've got something that's really slippery under ideal conditions.